Okay, so when you hear the word medicine, what's the first thing that pops into your head? Probably a doctor, right? Treating a single patient who's sick. But what if there's this whole other side of medicine? One that isn't about just one person, but about keeping entire communities, whole cities, even countries healthy from the get-go. Well, that's what we're diving into today, the world of population medicine. So let's break this down. It's really two different ways of looking at health. You've got clinical medicine on one hand. That's the classic doctor's visit. You feel sick, you go get treated. It's all about healing. But then you have population medicine. It steps back, looks at the whole community, and asks a totally different question. Hey, how do we stop so many people from getting sick in the first place? It's a huge shift in focus, from treatment to prevention. To make this super clear, let's take tuberculosis as an example. You've got a basic scientist in a lab staring down a microscope at the TB germ itself. Then you've got a doctor practicing clinical science, treating the patient who's already got the infection. But the population medicine expert, they're out in the community asking much bigger questions like, why is TB spreading right here in this neighborhood? What can we do, like screening or improving living conditions to stop it in its tracks? See the difference? Now this brings us to a really interesting puzzle. If this whole idea is so critical, why can't we all just agree on what to call it? The source material for this explainer points out that the history here is a real tangle of different names. And the definitions, well, let's just say they can be a little fuzzy. So what do we call this field? Is there one right term? Is it just one big idea with a bunch of different labels slapped on it over the years? Or are these actually different concepts entirely? Let's find out. We're going to take a quick trip through the history of the names themselves. For about the last century and a half, the names just kept changing. It started with hygiene. Then that morphed into public health. After that, you get social medicine. And now, more recently, you hear community medicine. Honestly, at first glance, it kind of looks like a branding exercise that's been going on for decades, right? But here's the thing, and this is the crucial point. These are not just different words for the same idea. Each one of these terms, hygiene, public health, social medicine, they're all distinct chapters in a much longer story. Each one represents a different way of thinking about how we as a society can stay healthy. It's really about the evolution of one single powerful idea. So let's actually trace that evolution. Because if we understand where these names came from, we can get a much clearer picture of what this field is really all about today. All right, so here's the roadmap. The journey starts way, way back in ancient Greece with this big, broad idea of hygiene. Fast forward to the 1840s, and public health pops up to fight all the epidemics in the new, crowded industrial cities. Then, just a few years after that, social medicine enters the picture, arguing that you can't separate health from your social environment. And it all kind of comes together in the 1970s with community medicine, which was really an attempt to synthesize all these different threads. So let's start at the beginning. The word hygiene, it actually comes from Hygeia, the Greek goddess of health. And this was the original concept, totally all-encompassing. It was seen as the science of every single factor that contributes to a healthy life. Pretty simple, right? Holistic and ancient. But of course, things changed. In the 19th century, you get these crowded industrial cities, and infectious diseases are just running rampant. A new, much more active approach was needed. So public health enters the scene. And this classic definition from 1920 by CEA Winslow just nails the shift in thinking. The key words to focus on here are organized community efforts. This wasn't just about your personal choices anymore. It was about society as a whole, getting organized and taking action. So as this idea of public health started to grow, it kind of split into two parallel paths. On one track, you had preventative medicine. This was all about specific technical fixes, think immunizations, right? The direct medical intervention. But on the other track, you had social medicine, and it argued something different, that you can't separate a person's health from things like poverty, or their housing, or their job. It's the difference between, say, giving a kid a vaccine and making sure that kid has clean water to drink. Both are crucial, but they're different approaches. And for decades, these two really powerful ideas, the medical fix and social action, they basically ran on separate tracks. But then, in the 1970s, there was this major push to bring them together, to get them under a single unified umbrella. And that umbrella was called community medicine. The whole goal was to create a modern synthesis, to take the best of everything that had come before. Okay, so what does this unified modern field actually look like in practice? I mean, how do all these different historical threads actually weave together to keep us safe and healthy today? Well, the modern toolbox is a multidisciplinary powerhouse. It is absolutely a team sport. You need epidemiologists, they're like disease detectives, tracking outbreaks and figuring out risk factors. You need biostatisticians to wade through mountains of data and find the real signal in all that noise. And crucially, you need social scientists to help us understand human behavior and the cultural stuff that shapes all of our health choices. It's that mix, hard data, lab science, and human insight, that really makes it all work.
And this is basically the game plan. It's a constant active cycle. It all starts with surveillance, right? Keeping an eye on the community's health to spot problems before they blow up. Then that data feeds into planning and managing, developing new policies and programs. After that comes the intervention itself, rolling out a vaccine campaign or a clean air initiative. But it doesn't stop there. The last and maybe most critical step is evaluation. Did our plan actually work? And then the whole cycle just starts over again. It's how the field is constantly learning and adapting.
All right, so we've traveled through a whole lot of history and a whole lot of kind of confusing terms. But why does any of this matter? Why is untangling this story important for us, right here, right now? Well, think about this for a second. For just one of those terms, social medicine, the source material says there are over 50, that's 50, different academic definitions. That just goes to show you how fragmented this field used to be. So understanding today's unified approach isn't just some academic exercise. The massive challenges we're facing now, from global pandemics to chronic disease, they demand a clear, coordinated, and really powerful response. Because when you boil it all down, after all the history and all the different names, the core mission is actually beautifully simple. It's about creating a world where fewer people need to see a doctor in the first place. It's about weaving health right into the very fabric of our communities. And that really leaves us with a final question to think about. Remember that definition from 1920? It used that phrase, organized community efforts. After everything we've all been through in the last few years, what does that phrase even mean to you now? What's our role in this? What's our neighbor's role in building a healthier world together?